Orthodontics. This branch deals with the alignment of teeth and the position of the jaws. It began taking real shape in the early 20th century, when dentists started using wires and bands to move teeth into better positions, rather than just extracting problem teeth. What sets orthodontics apart is its focus on function and appearance together, since a poor bite can affect chewing, speech, and even breathing over time. Braces, aligners, and jaw expanders all fall under this specialty, and treatment often stretches across months or years because bone and tissue need time to remodel around moving teeth. Orthodontists also work closely with oral surgeons in cases where jaw growth needs surgical correction alongside tooth movement. Periodontics. This specialty centers on the gums, the bone beneath them, and the tissues that hold teeth in place. Its roots trace back to early observations that tooth loss often had nothing to do with the teeth themselves, but with the foundation supporting them breaking down. A periodontist spends most of their time managing inflammation and infection below the gum line, since these problems can progress silently before a patient notices anything wrong. Deep cleaning procedures, gum grafts, and treatment of bone loss around teeth are common territory here. What makes this field particularly important is its connection to overall health, as periodontal disease has been linked to conditions like diabetes and heart disease. Endodontics. This area focuses on the inside of the tooth, specifically the pulp, nerves, and blood vessels housed within it. The specialty grew out of the simple but persistent problem of tooth pain that didn't go away with basic treatment, which led to the development of root canal therapy as a way to save teeth, rather than remove them. An endodontist works with extremely fine instruments to clean out infected or damaged tissue from inside a tooth's root canals, often under magnification. What distinguishes this field is the precision it demands, since the internal structure of teeth can be unpredictable and varies from person to person. Modern imaging techniques have made this work far more accurate than it once was. Prosthodontics. This branch deals with replacing missing teeth and restoring damaged ones using artificial devices. It emerged from centuries of attempts to recreate lost teeth, ranging from ivory and animal teeth in earlier eras to the acrylic and ceramic materials used now. A prosthodontist designs and fits crowns, bridges, dentures, and implant-supported restorations, working to match both function and natural appearance. What separates this specialty from general restorative work is the level of planning involved, since a full mouth reconstruction has to account for bite forces, jaw movement, and long-term durability all at once. It often becomes the final step in treatment after other specialists have addressed underlying issues. Oral and maxillofacial surgery. This specialty covers surgical procedures involving the mouth, jaws, and face. Its origins are tied closely to wartime medicine, where surgeons treating facial injuries developed many of the techniques still used today. An oral surgeon handles everything from wisdom, tooth extractions, to jaw realignment surgery, and in more advanced cases, treatment of facial trauma or tumours. What makes this field distinct is the overlap it has with general medicine, since practitioners often need training similar to that of medical surgeons, including hospital-based residencies in many countries. The scope can extend well beyond the mouth into areas most people wouldn't immediately associate with dentistry. Pediatric dentistry. This branch focuses on the dental needs of children from infancy through the teenage years. It developed as a separate field once it became clear that children's teeth, behaviour, and anxiety levels required a different approach than adult care. A pediatric dentist manages the eruption of primary and permanent teeth, monitors growth patterns, and often works to make early dental visits less intimidating for young patients. What makes this specialty unique is the behavioural element involved, since treating a child effectively depends as much on communication and patience as it does on clinical skill. Preventive care plays a much larger role here than in most other branches of dentistry. Oral medicine. This specialty deals with diseases and conditions that affect the mouth, but often originate from broader medical issues. It grew out of the recognition that many systemic diseases, from autoimmune disorders to certain infections, show early signs inside the mouth before appearing anywhere else. A specialist in this field manages chronic oral conditions, unexplained pain, and mucosal diseases, frequently coordinating with physicians rather than working in isolation. What sets this branch apart is its diagnostic nature, since the work often involves piecing together symptoms rather than performing hands-on procedures. It sits at the intersection of dentistry and internal medicine more than any other specialty. Oral pathology. This branch studies the causes and effects of diseases that appear in the tissues of the mouth and jaws. It took shape as microscopy and laboratory analysis became part of dental training, allowing practitioners to identify diseases at a cellular level rather than relying only on visual examination. An oral pathologist examines biopsies, identifies cysts, tumours, and other abnormal growths, and provides diagnoses that guide how a case should be treated. What makes this specialty essential is the certainty it brings to decisions that would otherwise be guesswork, particularly when distinguishing between harmless growths and serious disease. Much of the work happens in a laboratory setting, rather than directly with patients. Public health dentistry. This specialty looks at oral health on a community and population level, rather than one patient at a time. It came about as governments and health organisations began to notice patterns in dental disease tied to income, education, and access to care. A public health dentist designs prevention programs, studies disease trends, and works on policy that affects entire regions, such as water fluoridation or school screening initiatives. What makes this field different from clinical specialties is its focus on systems rather than individual treatment, aiming to reduce disease before it starts rather than repairing damage after the fact. Much of the impact here is measured in statistics rather than single case outcomes. Oral and maxillofacial radiology. This branch specialises in imaging the mouth, jaws, and surrounding structures to support diagnosis. It developed alongside advances in X-ray and scanning technology, as dentists needed clearer ways to see beneath the surface of teeth and bone. A specialist in this field interprets complex imaging such as CT scans and panoramic X-rays, often catching issues that would be invisible during a routine clinical exam. What distinguishes this specialty is its role as a support system for nearly every other branch of dentistry, since accurate imaging often determines how a surgeon, orthodontist, or endodontist plans treatment. The work is highly technical and depends heavily on understanding anatomy in 3 dimensions. Operative Dentistry. This branch deals with the direct repair of teeth damaged by decay, wear, or injury, using fillings and other restorative materials. It represents one of the oldest parts of dentistry, tracing back to early attempts at filling cavities with materials like gold, and later amalgam. A practitioner in this field removes decayed tissue and rebuilds the tooth structure using materials designed to bond and function like natural enamel and dentin. What makes this specialty foundational is its everyday relevance, since most people's first real dental treatment involves some form of restorative work. Advances in bonding materials and technique have made these repairs far more durable and natural looking than they were even a few decades ago.